We need more spaces that let people of the LGBTQIA experience know that there's a space for you. There are programs geared towards you and what you're dealing with, and there are people who get it. Hi, my name is Tae Barnum. I work in the Community Health Initiatives team. My pronouns are they, he, and I'm a community health worker here at the Mazzoni Center. I chose to work at the Mazzoni Center because I fell in love with the mission. I love helping people, I love serving my community, and I've also received services from the Mazzoni Center, so it feels great to give back. Community health worker continues to find resources, update resources, connect with other organizations that do similar work, connect with other organizations depending on what needs keep arising, whatever finds itself to be more popular. We do research to make sure that patients have access points, whether that be to medical assistance, housing assistance, SSI assistance, getting a paperwork or form for work, or a paperwork or form for like an insurance company for surgeries, or for advocation for work. We are community advocates helping the community. So people coming in wanting to like address any chronic illnesses, anything that they have been struggling with maybe their whole lives, or recent onset prognosis, diagnosis, and just having that support navigating through those systems, navigating medical assistance, navigating finding in-network providers, navigating finding a dentist, and different people who are accepting new patients and can meet the need, and like just slow down and let the patients know like what they're doing and what they need and why they need it. So myself and Ali, who's another community health worker here at the Mazzoni Center, we were looking at a patient case where a patient was calling in about their utilities being shut off and needing some assistance because they had been in the hospital and they had been receiving cancer treatments. They were talking about not really being able to do for themselves, not be able to clean their house, and just do the basic things that they were able to do a year ago. And that they just felt hopeless. So Ali looked at me and said, Tay, I think this person deserves a home visit. And I believe that we should go visit this person just to give them some community and provide just some support for them during this scary time. At the time they were doing chemo, and it was very scary for them. Sometimes they weren't able to move, sometimes they weren't able to get out of bed or even make their appointments. So we made a plan. This was last year. We went to go see them, and when we reached the patient, I believe they were so skeptical because they didn't believe that Mazzoni had a way to bring their services into their home. And I believe that the patient was very appreciative and very just shocked that Mazzoni cared enough to make the services accessible. What would be done in a health care room here, in like a provider visit room here, was being given to them right in front of their living room. And Ali really just wanted to take that time to support them. After we went to the patient's house, we went there for about 2 months, about maybe every other week. By the time we stopped seeing them on the 3rd month, they were able to physically come into Mazzoni, and they let us know that they were cancer-free and that they were able to move around like they were before their mother had passed away, before they got sick. So they had came into the building just to let the building know that how appreciative he was for us coming to his house, us bringing him food, us making sure that he had just those basic essentials that at one point he was able to do for himself, and just encouraging the patient that we're not giving you assistance because you're incapable of doing for yourself, but we're giving you assistance because we see you and we want to let you know that there's space for you at Mazzoni. And whether you get better or not, Mazzoni's going to make sure that we meet the mission of this place and to meet you where you're at. And I felt like it felt amazing to impact this person's life during during just like a scary time, and to know that we were given the ability to go to someone's house and help them, and that act alone changed the trajectory of their care, of their life, and that they're feeling better, it made me realize why I took on this position, and it made me just want to be here and find more ways to like reach people who are underserved or can't be served or need assistance that can't really ask. So I wanted to give a shout out to like my coworker for picking up that patient needed more, and I was thrilled to know that we added on to the patient's life as well as was a major impact on their healthy life and wellness. So I'm very excited and very pleased about that.